Welcome to the June 2023 YARR Summer Series. We are Anneliese and Amelia Williams. In today's video, we will be talking about the similarities and differences between federal and state governments and how that impacts rare disease policy. When the Founding Fathers wrote the Constitution many years ago, they knew the United States was too big and too diverse for a one-size-fits-all government. So they divided power between state and federal governments, each with their own legislative, executive, and judicial branches. State and federal governments were each given different jurisdictions, meaning their policies applied to different sets of people. The policies the federal government makes impact what a state is and isn't allowed to do. The state government has the autonomy to impact the laws governing people inside of its own borders. Think about it as each state is a car driving down a highway. In this analogy, the federal government would be responsible for setting the speed limit, the legislative branch making laws about what you can and can't do, policing the road, the executive branch, and making sure the speed limits are appropriate, the judicial branch. However, as the driver of each car, the state government has the autonomy to set different conditions for its own citizens, like turning up the air conditioning and choosing how fast to drive. So, how does this apply to rare disease policy and advocacy? Let's think back to our road analogy. We will start with the federal government, the road and its rules. For rare disease, these include agencies like the Food and Drug Administration, or the FDA, a government agency that plays a critical role in the rare disease ecosystem by regulating what medications are approved as safe and effective for patients to use, and the National Center for Advancing Translational Science, or NCATS, which includes the Division of Rare Diseases Research Innovation that conducts rare disease-related research. It also includes budget and appropriations, which means decisions about how much money the federal government is allocating to different areas. These decisions include choices about how much money to give agencies like the National Institutes of Health, the FDA, and NCATS, and can have a big impact on rare disease research and drug development. Furthermore, the Department of Health and Human Services also sets the Recommended Uniform Screening Panel, or the RUSP, which is a list of conditions that the federal government suggests all states screen newborns for. These are just a few examples of the many ways the federal government's laws, policies, and agencies pertain to rare disease. So, what decisions are left for the states? Much like how the rules of the road create conditions for driving, but individual people have to drive the cars, these federal policies create a framework within which the states operate. States, like drivers, have the autonomy to take the wheel. While this can look many different ways, some examples include administering physicians' licensing, including how physicians licensed by other states are or are not covered, and how other healthcare providers like genetic counselors are covered, establishing a state healthcare plan for services and pricing under Medicaid, deciding which diseases and disorders to screen newborns in the state for based on RUSP recommendations or other state additions, and other laws and policies that pertain to rare diseases. Interested in learning more about how you can affect policies at the state and federal levels? Follow along for more information and advice from us soon.